Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. X-linked adrenoleukodystrophy and also the Canavan's disease. So here in X-linked adrenoleukodystrophy, it involves the posterior lobes predominantly. So posterior lobes are mainly involved, and there is the splenium and the peri-trigonal matter. So there is splenium as well as there is a peri-trigonal matter. Then we move on to the Canavan's disease. So here in the Canavan's disease, it is nothing but a continuous diffuse white matter involvement. So the continuous and diffuse white matter which is involved. So involvement is seen, and this increased the NAA peak. So increased NAA peak is also which is observed. To learn and grow daily like this, please do subscribe.